Hey guys, welcome to A Sip of Aesthetics, where we're talking about aesthetic medicine, regenerative medicine, anti-aging, and a lot of interesting things that we see here at the med spa and in the anti-aging industry in general. Today we have Annabelle with us, and we're going to be talking about acne.
Yes.
So Annabelle, I know you like that topic and you work with a lot of people who have acne, which is why I think you're a great person to be, talking about this subject with me. So, what kind of treatments do you think or people should be doing?
Acne is something that people come in regularly wanting to have a consultation about. Me personally, I am very acne prone, so I always feel like it kind of hits close to home for me, and I really like talking about this subject for that reason. Treatments for acne, they can vary depending on what type of acne that person or patient has. So obviously active acne can be treated only in certain ways versus acne scarring. So I would approach those patients differently.
For sure. And so we can talk about maybe just acne initially, like active acne, and what are some treatment options. And we can talk about acne scarring because we obviously see both. We see people who had acne and it's gone, but now they have all these scars.
Yes.
Then we have people with active acne. And what are some ways we can approach somebody with active acne? So
active acne is a little bit harder, if I'm being honest, just because if they have a lot of whiteheads or pustules, we can't necessarily do like microneedling over that because we don't want to spread bacteria and we could make the acne worse. So for active acne, I typically like doing, an IPL, maybe on like the blue filter to help with that bacteria. Chemical peels are a nice option, or even just like the sulfa face wash that we have. That's always something that I recommend to patients.
So, and basically what I'm hearing is when somebody has active acne, it could be a combination of treatments, even between, and by the way, active acne, we're talking about people who actively have an acne breakout as opposed to
new active acne that just came about within the past couple of days, has active whiteheads on it, pus inside of it, things like that.
And even within active acne, there's could be different types. So there's inflammatory, there's non-inflammatory, cystic, pustules. And so I think what we usually do, and I know what you also do, is it could be a combination of treatments that they might be taking at home, like you mentioned, the sulfa wash, or in some, instances, it could be even prescription medications. With cystic acne, sometimes there are, things like Accutane might be a treatment
or even
of
sometimes
choice.
Birth control pills. Maybe it might be a hormonal imbalance that we're trying to regulate. Active acne is definitely different layers to treating it. It's not just one, laser treatment that's going to resolve the problem.
Exactly. And somebody who has like really severe cystic acne might need, something stronger like Accutane, but because Accutane also has its own side effects, we're not going to do that for somebody maybe who has more mild forms of acne.
Absolutely.
Or who hasn't tried, other treatments that are less aggressive than Accutane to see if these treatments work. And again, the treatment can be a combination of things that they're doing at home, whether it's a wash or a topical treatment they're applying or a pill they're taking, hormonal or not, and things that sometimes can be done to speed the process. What are some of the things outside of the medication that can speed up the process? I know you mentioned an IPL, which is a laser.
Yeah. So an IPL is a laser treatment. We can do it on a blue filter, which will just help kill bacteria on the skin. And then another option would also be a chemical peel, which is just going to help kind of slough off that top layer of skin, just have skin cell turnover. And that also helps with active acne as well.
Awesome. And I know even with the peel, you can go like mild or more aggressive. And that's why it's important to always, talk to somebody, provider.
Consultations for acne are so important because acne can vary so many different ways. So definitely come in for a consultation in person so that we can kind of pinpoint what kind of acne you have and what treatment best fits you.
Perfect. Now, say somebody is not having active acne breakouts anymore, but they are, they still have like scars from previous acne breakouts, whether they're sometimes there could be discoloration, like pigmentation changes in the skin, or it could be like pitted scars in the skin. Would the approach be different for something like that as opposed to an active acne breakout?
100%. We definitely would approach just scarring in a way different way than we would approach active acne. I would say for scarring, we can do something more aggressive, like a CO2 laser for full skin resurfacing, or we could do microneedling, regular, or even RF, depending.
Yeah, and with I think with the scarring, you do see uh, like a bigger role for also like treatments like machines and stuff because I don't know if any like really good medication pill that can be taken
to help with
for
scarring.
acne scars
For
like
sure.
you have for active acne. So that's when it's really it can be really useful to have access to certain treatment options like you've mentioned. So you've mentioned the microneedling and the
Yes.
radiofrequency microneedling. That's what RF microneedling are. And just tell us a quick overview of what these treatments are.
Depending on the scarring,
Okay.
would kind of be where I would recommend one versus the other. If someone maybe has, a skin type 2 or a skin type 3, they're more fair and they have pretty aggressive scarring, I would probably steer them more into the CO2 realm for a treatment, just because CO2 is an ablative laser and we can go a lot more aggressive on settings and probably get a faster result. But depending on, maybe that person has more mild scarring and is maybe a deeper complexion and they wouldn't be suitable to do an aggressive CO2, I'd probably steer them in the direction of doing traditional microneedling, even maybe add some like PRP on top of it as well.
What's PRP?
PRP is when we draw the blood and we spin it and we kind of get the platelets and growth factors out, and we can apply it topically to the skin to kind of supercharge the results, essentially.
Awesome. Perfect. I actually love PRP too. It just sometimes I do feel like it makes the healing process a little bit quicker, and
For sure.
it's a good addition to these treatments. So maybe something like a CO2 laser for kind of more severe scarring and somebody
Yes.
who's more fair skin. Microneedling or RF microneedling is another option. What about like pigmentation changes? Like discoloration, brown spots, or anything like
So
that?
both of those treatments help with hyperpigmentation, CO2 and microneedling. But once again, it kind of depends on how severe the hyperpigmentation is and what kind of skin type that patient has. Also, another option for hyperpigmentation would probably be an IPL. I know I said that IPL is good for active acne, but it has different settings that we can set. And it also is really, really great for hyperpigmentation, any dark spots that are left behind after the acne heals.
Awesome. And I do agree. I think this is a really good point that you can use an IPL sometimes for active acne, sometimes for pigmentation, and you would adjust the settings as you've said to
Different
kind of be able to target
filters,
it
different settings. Yep.
more often. And what else do you tell your clients that have acne? Any other like tips or things that they should keep in mind?
For sure. Acne is such an interesting thing. We definitely have a lot to cover with it. One of the things that I talk about is being really cleanly with the skin at home. Sometimes acne can start happening on the forehead or wherever on the face because maybe we're not being super sanitary. Have dirty hands and we're touching our face, or we're not changing our sheets at home. So I always like to keep that in mind. Also, different topical things that we're putting on. Maybe not everything is suitable for your skin and you're having an unwanted reaction. So we definitely like to go through what the patient is using as far as skincare goes. We want to make sure that they're using good quality products, things that aren't going to trigger acne. And I know it's a little controversial, but I do think that sometimes it can be related to diet. Some things that we're eating might also be upsetting the skin. Yeah, anything else that you can think of?
Yeah, so we're telling them like what things they can do to avoid, future breakouts in the first place. And some things are kind of more easy to control versus some things like hormones can be a little bit more
That's another
difficult to
tricky
control.
one.
But
Absolutely. And then another thing that we didn't mention that we do quite often in the office is sometimes if any patient has an active acne that's maybe kind of tender and is hurting them, they can actually come into the office and get a little cortisone injection, and it helps flatten it out and heal a lot faster.
Gotcha. So for like if somebody wants, if they have like particular, acne nodule, 1 or 2,
Yes.
and they can get them injected with cortisone.
A very small amount of cortisone. Don't overdo it because it's a whole different thing if you start to overdo it.
Well, and here's the thing: if it's overdone, the problem with putting too much cortisone is it can lead to almost like a scar or like
like a
loss,
dent almost in the face, which is unwanted, obviously.
Yeah. But on the other hand, too, a lot of time if you leave, if it's a big nodule and you don't do anything about it, it can also heal with a dent. So you gotta find the right balance.
The balance, exactly.
Absolutely, yeah. So sometimes it is safer in a sense to treat it as long as you're doing it right, because if you don't, then there is a risk of the
also leaving a dent or a scarring of some
Exactly.
kind. Absolutely.
Yeah, and that's why unfortunately a lot of people who are not having any more acne breakouts, as we started by saying, they're still coming in because they have now the issue of all the dents and scars that are left in their face from the time they had acne.
Definitely a process. Acne versus scarring, it's a long journey.
Awesome. Well, thank you for coming. I think that was very helpful.
Inviting me.
And obviously, we'll always say, go see, professional, because we try to give you as much information as we can in these podcasts. But as we have said, every person is a little bit different. So depending on the type of acne you're having, depending on what kind of treatment options are available and what you're looking for, you want to talk to somebody who can kind of guide you personally throughout the way. But it's good to be informative just to kind of see what kind of different options you might have.
Definitely. Perfect.
Thanks for coming.
Thanks for having me.
Thank you guys for joining. Like the episode. If you're still here, make sure you subscribe and leave any comments below.